So welcome to January 2020's video blog. I hope everybody had a great Christmas and New Year. Just a few bits of update for everybody in the new year. So firstly, a really exciting update. We've been commissioning an organisation called Working Time Solutions to give us some help to review our working patterns across the organisation. So that piece of work has been continuing for the last few months, and we're at the point now where we're going to start to redesign and review all our working patterns across the organisation. So we're starting with our urgent care services for both clinical and non-clinical staff. The benefits, I think, are going to be quite significant for staff and the organisation. So it will allow staff to more flexibly pick and choose and change their working hours and working patterns. It will allow the organisation a lot more flexibility to change working patterns in line with demand for any given service, and also it will allow us to introduce some much smarter ways for staff to access information on their working times and working shift patterns. So for instance, we'll be introducing an app that people can use to log in and review what their working time will be. So we're really excited about the piece of work. It'll be rolled out from February onwards, the project, and the project's called Our People Project. Crucially though, we absolutely need staff participation, because part of the principle of the Working Time Solutions model is that it engages staff to help us design and agree what our working pattern should be across the organisation to meet the demands. So communication will be coming out via the e-bulletin, and specifically more directly to staff working in particular services, asking for your participation in a number of working groups that will be looking at working patterns over the next few months. So please put yourself forward. We think it's a great piece of work that will really benefit both patients and staff in the organisation in the future. So a second really exciting update to share with you is that as an organisation we've been accredited to be part of a place-based pilot initiative, which will enable us to be part of a collaboration of providers which includes Manchester Met University, Manchester University, the Christie, Greater Manchester Training Hub, Integrated Care Foundation Trust at Tameside and Glossop, Tameside and Glossop Care Together, and Millgate Partnership, to deliver completely new styles of training experiences for nurses based within communities and along whole patient pathways. So initially it's available for nurse training placements, but also can be extended to physiotherapy training in the future. So we're really excited. We think it's the first, certainly in the Northwest, and one of the first pilot initiatives like this across the country. And I'd just like to extend my thanks to Andrea Hanley, our Head of Clinical Services, Margaret Hayes, Naomi Meller, and also Claire Mann, who as a team have worked incredibly hard to get us here. So we're really excited, and we're going to hopefully welcome a number of new nurses to develop a new experience for them during their training. So the last video blog I shared an update on the partnership that we've been developing with the LGBT Foundation in Manchester to put together a proposal to deliver a brand new Greater Manchester-wide trans health service. So this is a nationally commissioned regional pilot across Greater Manchester to provide services for the trans community that are been referred for gender reassignment in primary care across Greater Manchester. So at the last update, I think I shared that we were putting together a bid, which we've subsequently done. We were successful in being invited to go along to a bidders interview on the morning of the 23rd of January, where we answered a range of questions and clarified our model and thinking behind our proposal, which went well. The next step is that we find out within the next 2 to 3 weeks whether we've been invited to submit a more detailed bid, which we're hopeful of, and final evaluation and decisions will be made by the end of March. So we're really positive about the service and are hopeful that we'll be getting through to the next stage. So I'll update you further once we know more. So just a brief update on primary care developments. In December, I welcomed Gordon Street from Ashton to the GCD family. We're also now working with a practice in Buxton in Derbyshire. So we're at the advanced stages now of our due diligence process and are hoping that we'll be able to complete that transfer by the end of March this year, 2020. So I'll be able to give you more details of the practice a bit close to the time, but we're really excited because the practice are great, the staff group that we've been meeting are really positive, and also it's a new area, a new CCG for us to work in. So as I say, I'll give you more updates a bit close to the time when we know more. So and finally, just a really warm welcome to our new Head of People Services, Holly Jones. So Holly joined us on Monday, the 27th of January, and will be working within the head office services and providing leadership to our HR team, but also will be helping launch and roll out our academy, which we've updated on in previous bulletins and will be sharing more details of in the future. So Holly's really keen to get out and about and meet as many staff as possible, as many managers as possible, so she can understand some of the challenges and pressures and opportunities for supporting the workforce. So I hope you give her a warm welcome when you meet her, and we're delighted that she started. So that's it for this month. Tune in again in February for more news.